The therapist's struggle. A patient's internal conflict. Patients often come to therapy seeking connection. They want to feel understood and supported. However, they also come with a fear of vulnerability. This fear makes them want to hide their true feelings. This creates a conflict. Patients want closeness, but they also want to protect themselves. Therapists must understand this conflict. It is a natural part of the therapeutic process. Patients need to feel safe before they can truly open up. It is important for therapists to remember that this conflict is not personal. It is not a sign that the patient doesn't trust the therapist. It is simply a reflection of their own internal struggle. Therapists need to be patient and understanding. They need to create a space where patients feel safe to explore their feelings, even the ones they want to hide. Ignoring the conflict, a recipe for stagnation. When therapists ignore the patient's conflict, therapy can stagnate. The patient may continue to come to sessions, but they will not make real progress. Ignoring the conflict can also damage the therapeutic relationship. The patient may feel unseen and unheard. They may start to believe that the therapist doesn't really care. This can lead to feelings of frustration and hopelessness for both the patient and the therapist. The therapist may start to feel like they are failing the patient. The patient may start to believe that therapy is not helpful. Ignoring the conflict is a lose-lose situation. It is essential for therapists to acknowledge and address it directly. Working relationship. The heart of therapy lies in the working relationship between patient and therapist. This relationship is built on the way both will apply to the patient conflict. When the therapist ignores the patient's conflict, the relationship suffers. The patient senses the therapist's avoidance. They may feel like they are not being truly seen or understood. This can create a distance between the patient and therapist. The patient may withdraw further into themselves. They may become less likely to share their true thoughts and feelings. To foster a genuine connection, therapists must be willing to lean into the patient's conflict. They must create a safe space for the patient to explore their feelings without judgment. Section 4. The power of now. Observing the patient's responses. Therapy is not about following a script. It's about being present with the patient in each moment. This means paying close attention to the patient's verbal and non-verbal cues. Therapists need to be keen observers. They need to notice subtle shifts in the patient's body language, tone of voice, and word choice. These cues can provide valuable insights into the patient's internal state. For example, a patient may say they're fine, but the body language might suggest otherwise. They may avoid eye contact, fidget, or speak in a monotone voice. By observing these responses, therapists can help patients become more aware of their own feelings. This increased awareness is essential for growth and change. Section 5. The answer lies within. Understanding the patient's truth. Therapists are not there to provide answers or solutions. Their role is to help patients discover their own truth. The answers to the patient's problems lie within the patient themselves. Therapists should avoid imposing their own beliefs or values on their patients. Instead, they should focus on creating a safe and supportive environment for patients to explore their own thoughts and feelings. This can be a challenging process. It requires patience, empathy, and a willingness to sit with discomfort. Ultimately, the goal is to empower patients to become their own best healers. Therapists are simply guides on this journey of self-discovery. Section 6. Practical tips. Staying focused on the patient's conflict. Here are some practical tips for therapists to stay focused on the patient's internal conflict. Start each session by checking in with the patient on what they want to focus on for their benefit. Find out the patient conflict. How feelings triggers anxiety trigger defenses. Pay attention to the patient's nonverbal cues. Notice their body language, tone of voice, and eye contact. These cues is there for you to check in with the patient what they mean. Reflect back what you are hearing and seeing. This helps the patient to be in the driver's seat and his will to work in the pay. It also helps them become more aware of their own feelings. Ask clarifying questions. This shows the patient that you are listening and that you want to understand their experience. Avoid giving advice or offering solutions. Your role is not to fix the patient's problems, but to help them find their own way. By following these tips, therapists can create a therapeutic environment that is conducive to growth and healing. Thank you for watching, and please share your feedback.